Hello, my name is Dr. Vennie from VENRO Healthcare. Welcome to the VENRO Health Groove. Today we have a question from Annabelle. Annabelle from Najera is asking why her periods are very painful. We will be getting into why periods are generally painful for some women. This might not answer Annabelle's specific question, but it's going to give her clues on what could be the cause. The best thing is to actually go and have an assessment, but we'll go into when you should actually have an assessment done by a doctor regarding painful periods. Now, first, before we go into the periods, I believe it's important for us to have a small discussion on the female anatomy. I think that will be helpful for our discussion. So that picture over there is just the picture of anatomy. You can see the ovaries over there. The ovaries produce the eggs. Yeah, they have the eggs, but women that help us actually have babies. It's the eggs that are fertilized by the sperm in order to have babies. So the ovaries keep the eggs, and then connected to the ovaries, those tubes over there are called the fallopian tubes. Now the fallopian tubes, very delicate tubes, and that is where fertilization occurs. When the egg is released, it will move to that tube and the sperm will swim and find it in the fallopian tubes and fertilization happens. When that happens, the fertilized egg is supposed to move down into the uterus, which is the womb. That's where it settles, attaches itself, and it will grow into a baby for a period of about 9 months. Now, when it's due, the opening of the uterus or the womb, called the cervix, will open. It will open to let the baby come out through the vagina. So sometimes that is not possible. That process becomes complicated, and we have to do what they call a cesarean section, which is a cut through the abdomen to get to the womb and get the baby out. Okay, so I hope that is helpful. Now, the menstrual cycle or the menses or the periods come from the uterus. And there is the process that we call the menstrual cycle is really a very complex process controlled by so many hormones. And it's meant to prepare your body for pregnancy. So during the days in between your bleeding or the periods, the body is getting ready for pregnancy. It assumes that you should always be ready for pregnancy. However, of course, for the most part, most of us do not become pregnant, either because you're not sexually active or you're using a contraceptive. Now, when you don't become pregnant, then the preparations for the pregnancy become useless, and the body has a way of dealing with that. The brain will send a signal to your uterus through some chemicals called hormones. And that signal will tell your uterus to peel. So all the preparations of inside the womb that were getting ready to receive a baby, they now have to be shed. So those cells now peel off, and they are what you see in your period. So the period blood, it has mucus, it has some cells. All of these were in the uterus waiting for the baby. Now, let's go back to Annabelle's question. What could be the cause of her painful periods? You know, it can actually be very discomforting. For most ladies, this process is normal. You will go through your periods, have a bit of discomfort, and it's mostly okay. However, there are few ladies who experience very painful periods, and I believe Annabelle is one of them. Otherwise, she wouldn't be asking this question. Now, there are various causes of painful periods. One of the commonest, well, not commonest, but the one that people talk about the most is what we call endometriosis. Do not worry about the big term. I'll simplify it. So this is a condition where tissue that is similar to the lining or to the inside of the womb grows outside the womb. So sometimes it can grow in the pelvic region. Sometimes it just goes and grows in the tubes. Now, when the brain sends the signal that we talked about to the uterus to tell it to shed these cells because you haven't become pregnant, the same signal goes to these other cells outside the uterus because that act as the uterus, because they have the same behavior as cells of the uterus. Now, because they are in the wrong place, they behave like the uterus, the lining of the uterus, but they are not actually in the right place. They are not in the uterus. The process of them peeling from wherever they are is very painful. That's why people with endometriosis end up with painful periods to the point that they cannot continue to function normally. If they work, if they are students, you find the student can't even go to class. They just have to sleep and rest. Okay? The other cause of painful periods is fibroids. I think fibroids are very common. They are swellings within the uterus, and these swellings are not cancerous. So as long as it's non-cancerous and in the uterus, it's called a fibroid. Fibroids also tend to cause painful periods. Sometimes people get painful periods because they have infections within the reproductive system, or what we call the pelvic inflammatory disease. If you have infections, you might end up with very painful periods because infections generally cause scar tissue within the reproductive system, and that makes the process of menstruating very painful. There's another condition which the doctors call adenomiosis. Here again we have tissue that behaves like the lining, the top lining of the uterus, now growing within the muscles of the uterus. So instead of it being on top, it's now inside the muscles of the uterus. Again, that process of pinning is very painful, and you may end up actually not being able to do any work. So when do you think you should seek for medical care? You should seek medical care if ordinary painkillers like Panadol, like ibuprofen do not work. You take them for your periods, they don't work. Then you need to seek for care. You need to come for further checkup. If you've also previously had normal periods and they start to become painful, or the pain is progressively becoming worse, it's important that you come for a checkup. Okay? So anything that's outside the usual should actually be checked. The good news is, for most of the painful periods or cramps that are not caused by a special infection, they tend to improve after you have a child. After your first baby, most women actually have this pain lessening, and for some it actually disappears. Okay, so I hope this has been helpful in case your cramps are worsening, or in case you have pain that actually prevents you from doing any work, please do seek medical attention. You will find a solution, or you'll get a solution for those cramps. Thank you very much for asking these questions and for listening and following the channel. Don't forget to subscribe and share with your friends so that you spread this useful information. Goodbye.